Hi, good evening, everyone. Thank you for your patience. We're sorry we're a few minutes late. Of course, it's never a dull moment here. We had some technical difficulties, but we are through that. Thank you for joining us. Good evening to everyone, and welcome to SIRA Talks. I am your host, co-host, Rashmi Chanduraj, and co-founder of SIRA. I'm so grateful that all of you have given yourself the space and you're here for yourself. So thank you. At SIRA, we truly believe that growth doesn't have to be sort of lonely. We believe in real honest conversations, in sort of emotional truth and really creating spaces where we as women get to just be ourselves, right? Our authentic selves, no masks, no pretenses, just our real, maybe messy, but powerful selves. And yet, today's topic kind of touches each and every one of us, right? I mean, honestly, whether it's male or female, I think it touches each one of us. But this is obviously something that speaks to us more closely, is mental health. And it's we kind of carry this confusion or shame or silence around this. Really don't want to talk about it. Maybe it kind of feels heavy, maybe too personal, or like something we should have figured out, a long time ago. Uh, but it's okay. This hour, what we're going to do is, a pause, check in on ourselves, listen to ourselves, and really ask for that support. Ask ourselves for those hard questions that we probably are pushing away, right? Like we've done this maybe repeatedly, but I want each one of you to give yourselves that time, pause, and take a deep breath, like shrug that shoulder and get ready for what we have. You are not behind, you're not alone, and you don't have to figure it out for yourself. We're going to be in this together.
Yeah, thank you, Rashmi. Our mind deserves as much attention as our body. Hi, I'm Deepa Shah, co-founder of SIRA, and today we're here to understand and care for our mental well-being. And we have with us Dr. Lakshmi Pandit, who is a professor and head of psychiatry at Sri Atal Bihari Vajpayee Medical College, and previously was a professor and head of psychiatry at KIMS Bangalore. With over 30 years of experience, she not only has clinical expertise, but also has a deep, compassionate understanding of women's mental health. Her areas of interest include adult psychiatry and women's mental health, and she's equally passionate teaching both undergraduates and postgraduates. I'm so happy you're here with us, Dr. Pandit. Welcome.
Good
And
evening, and a big hello to Deepa, Rashmi, and everybody else who has taken time off to join us this evening. It gives me great pleasure to be here because, like you mentioned, adult psychiatry is one of my interests, and along with that, women mental health. I work with a lot of women, so it gives me great pleasure to be able to share my insights as a psychiatrist, with all the wonderful women who are here today to listen to us.
Yeah, that's awesome. I can't echo the same sentiment more than what both of you have just, mentioned. But thank you again, Dr. Pandit, for being here. Let's actually get started. I think let's look at what is mental health. What do we understand by the term mental health? Can you kind of walk us through, what that means to, a woman?
Right. Now, physical health is a concept we all understand. So, physical health is about, being up and about, being well, being healthy, not being ill, able to do our jobs, attend to our duties. Now, the uh, counterpart of that is mental health. So, when we say mental health, it talks about psychological well being and emotional well being, social well-being. And what do I mean by all of that? When I say psychological well-being, it means an individual who has a sense of purpose in life, who has self-esteem and respects herself. When I talk about emotional well-being, it means uh, there are a lot of things thrown at us all day long and all life long, and dealing with that, in a positive way, and being able to handle all the emotions that it brings out in us, that is emotional well-being. And social well-being is functioning well in the realm of interpersonal relationships. So I deal with all the individuals I come across on a day-to-day basis in a comfortable and positive way, so that I feel well and good about it. So this sum and substance would amount to uh, mental health and good mental health.
Yeah, no, that's great. How does this sort of, make women more sort of susceptible to these, mental health issues, whether it's emotional well-being or social well-being?
So, yeah, if we look at, is the woman more susceptible to issues? I would say yes. So when we study certain disorders, for example, depression or anxiety, or a woman presenting with multiple bodily complaints, we see that the women are in majority, who walk in with these disorders. So that says that in some form, women are more susceptible. We do have all the other components in terms of most of these disorders being genetically governed also, could run in families. Women uh, tend to react emotionally to negative emotional stimuli and to anxiety as a stimulus as well. So therefore, they are more susceptible. The hormonal changes in women, also, like we all know, is much larger, or it is so fluctuant in the entire reproductive health period of a woman, that makes her more susceptible to all these issues.
Yeah, that's actually interesting. I wanted to find out, like, is there a stage in, a woman's life that, makes them more susceptible, or, like what is your sort of understanding of, early womanhood to, like maybe in women in their 30s to, folks who are, or women who are going through menopause or premenopause or post, what do you, believe that you know the mental health radar is for each of these stages?
Yeah, like you rightly mentioned, there are a lot of stages where,
Yeah.
we have huge ups and downs and upheavals. So if you
Yeah.
look at the menarche stage, when a girl attains menarche, somewhere between the ages of, maybe as less as 10, maybe even 15, the average age is around 12. So when that happens, it's a huge upheaval in the girl's life. One is in terms of the hormonal changes that happen at that time, and
Mhm.
also all the emotional adjustments that the child has to make, that the girl has to make, in terms of how do you behave, what do you do, what do you not do, all the restrictions that are imposed, because now the huge, safety well-being factor comes in, and the family becomes overprotective, and the entire life of the child changes. So menarche is a huge adjustment phase. If that is not dealt with, in a very healthy manner, it could lead to issues. It could lead to, a low mood. It could lead to anxiety. Similarly, let's take every menstrual cycle of every woman. We have huge ups and downs in hormones. And when that happens, we typically have what is known as the premenstrual syndrome. The
Mhm.
premenstrual syndrome is a phase where there is water retention in the body. It's a biological change. The woman gains weight. There are severe mood fluctuations, becomes very irritable, is more anxious, also feels, lethargic, is not able to attend to all the day-to-day activities in a very healthy, active kind of way. And this may last anywhere between uh, 4 to 5 days premenstrual, which is not a very good place to be. And a lot of individuals, premenstrual, get what is known as a menstrual migraine if they're prone to migraine. And that is even more incapacitating. That can be usually premenstrual, can happen in the 1 or 2 days post-menstrual as well. So that's about every menstrual cycle in a woman's life. And then we come to pregnancy. So in pregnancy, the physical load on the body is, I think, something that we all see, but we don't understand the psychological stress that the woman goes through. In terms of an entire change of lifestyle, a lot of limitation to her day-to-day activities, and a lot of restrictions that happen, in her lifestyle. The Probably one of the greater contributors would be the post-delivery period, postpartum, where mothers are prone to what are known as postpartum blues. In the first 2 to 3 days to a week or so, there's a feeling of a low mood, there are crying spells, and nothing seems good, and becomes overprotective of the baby and irritable and very weepy. That's a postpartum blue. But that period usually goes away if it is tended to properly. Nothing really there to worry about. It's pretty common. But what we do worry about is postpartum depression, where they go into a very depressed state, where there is what we call as a pervasive low mood. They're sad all throughout the day. They lose interest in taking care of the child. Nothing seems important. They don't eat, they don't sleep. And there are times where the mother feels that I don't want this baby, I want to give it away. Or so, like one of the women was saying, I want to pick it up and actually harm the baby because I feel, I don't want to live, so why should my baby live? And there are suicidal thoughts. That's a very severe depression that can occur in the postpartum period. And sorry. Also, postpartum, uh, yeah, let's say everything is normal, there aren't any issues, and they have the baby. Even in that period where for 2 to 3 months they are restricted, they're not allowed to go out, they don't get to do normal activities, they cannot eat out, what they eat, what they drink, the temperature at which they drink water, like everything is controlled. It's a super controlled environment. That is because the child has no immunity and nobody wants to expose the child to infections. So that restriction I have seen bears very heavily on the mother, especially if she has been a working woman and her entire life has changed. And then, of course, the menopausal period where the hormone fluctuations make one highly anxious or depressed. The hot flushes, which can last for half an hour to 1 hour, makes them extremely uncomfortable because the ovaries have stopped producing estrogen. So typically, these are the phases that we are concerned about in any woman. Any woman can undergo any of these issues that I have just spoken about. We must remember that added to this is the environment. So, the socio-cultural environment is, let's say, protective, helpful. The woman, can bear it better. But if the environment is stressful, it only adds to the issues. It doesn't help in solving any problems.
Yeah,
Wow.
no, that's really powerful. Thank you.
Yeah. Uh, Dr. Lakshmi, that was quite insightful, knowing that women have many more phases to deal with versus men. Your body is undergoing so much of changes at every phase, and then that throws up your body into chaos and dealing with it mentally. Yes. Now let's move on to stress. I mean, we keep hearing this word stress. Even a child says, I'm stressed very often. Nowadays, it's become a common phrase. What
Very true.
is the word stress mean, and how does it affect a person?
So, first of all, when we use the word stress, we need to understand that stress can be physical or psychological. So, physical stress on a body is any illness you may have, an acute illness or a chronic illness, or let's say an injury, an accident, the requirement of a surgery, the undergoing all of that is physical stress. So, physical stress bears as much issues on the mind as the psychological stress as we understand it. Psychological stress comes from your environment. So, what basically happens is that there is an imbalance. It's like a demand supply issue. So, you have a certain set of coping mechanisms and the ability to deal with a certain amount of stress. But when the stress is like an onslaught, then there is a mismatch between the demand and the supply, and both the body and the mind can crumble under that.
Hmm.
So stress is basically the demands that are placed on the individual in terms of body and mind.
Right. So how do you identify these early signs?
So yeah, I guess it can easily be missed, because when a person is undergoing stress of a level that is not actually perceived as stress,
Hmm.
the experience of that stress or the effects of the stress tend to be misplaced.
Hmm.
uh, as in, I'm stressed at home and I'm working as a teacher in a school. I go there and my stress is evident when I'm going to get angry with the children, when I'm going to be irritable, I'm going to shout when I'm not supposed to, or I'm going to be rude to any of the attenders there. So the early signs of stress are, say, anger, irritability, the inability to sleep well, the inability to eat well. Sometimes we have what is known as stress eating, because eating is a comforter. So we would just go pick up something, and there are certain foods that feel better. So anything that is, has more carbohydrate or more fat in it, those are very satisfying. Remember, digestion happens at the level of the mouth itself. So as we are eating, the feel good starts. And so you want to eat more and more. So these are the early, signs of stress. We can also have mild physical symptoms like, say, headache and, several body pains, etc. And it's difficult for us to perceive that this is because I am stressed.
Right, because it's so common, and women are made to be resilient, or even if they're not, they're expected to be resilient. And these are so easily masked, right? In your everyday, it's masked. So you tend to put up a brave front and not show up your stress. So what would be the effect of having, masked it for a period of time?
So
How would
if you have bottled up stress that you can't really address, see, the issue is that you can't address it, so you bear it for whatever reason. The We were talking about the acute effects. Now, unfortunately, the long-term effects are pretty much severe. So long-term effects of stress can be on your cardiovascular system in terms of heightened pulse rate or hypertension. On your digestive system, you can develop an irritable bowel. You can develop chronic gastritis. On your hormonal system, on your respiratory system, people who have bronchial asthma, they inevitably have huge bouts when they are stressed. Let's say somebody has a skin condition, what is known as pruritus. So, apart from the environmental conditions, under stress, their pruritus increases. So, they tend to, it itches and they scratch, and sometimes they even bleed. So, stress works on the entire body. So,
Mm,
right from your mind, right up to every cell in your body, it is acting. So, if you have a pre condition already, it is almost definite that stress would worsen it. Nowadays, if you can see a lot of people, even youngsters, come with back pain because they work in IT, they sit for long working hours, and they're stressed as well. So they tend to hold their muscles so tight that by the end of the day, their back hurts, and the end of the day, their neck hurts. So stress adds to, or literally is causal for all these things. So we very many times you're tempted to ask, they have a huge neck pain, say, who or what is your neck pain? Who or what is your back pain? Because the environment is such a huge contributor, to those set of symptoms.
So, from what I hear, your mind will actually dictate how your body functions, right?
Absolutely.
Right.
Absolutely.
How much more important is that than to take
Yeah.
care of your mind,
Yeah.
right?
But yeah, it's a
Yeah.
little sad that we don't even stop to think about it. And we
Right.
don't think that, mental health is as important as physical health. We
Yeah.
don't even know, and therefore we don't recognize.
Yeah. So there's this important question of women tend to, be made to, or the expectation of a woman is to be perfect at everything, And one is that, and one is you're made to feel guilty if you prioritize yourself. How would you address these both issues?
So I would say this has kind of come down the generations, that it is kind of almost encrypted on your DNA that if you are a woman you have to be more tolerant, and you should not complain, and you should be the balancing factor at home. I wouldn't say it is wrong. See, all interpersonal relationships are about give and take.
Yeah.
You give, you get, and you balance. But sometimes the demands become so much that it acts on your body and mind. But there is an expectation socially, culturally, that the woman needs to have a certain degree of perfection. So you need to be the perfect wife, perfect mother, perfect daughter, daughter-in-law, etc. All the multiple roles. And now that women have started working, you go to work and you have to be the perfect employee there. And I would also go so far to say that you have to prove yourself a little harder because you're a woman. And the question of can this person handle this because she's a woman is a question, I'm sure, that is somewhere at the back of most male minds. Apologize to those who don't think that way, but it is there somewhere, is embedded, is what I would say. So the woman has a lot to live up to, and in that art of juggling, she tends to give herself up and push it in the background. Even if I do recognize it, I don't want to tip the apple cart. Let me keep this balance because I don't want to bear the consequences of what comes out of it. And so I will balance, balance, balance till such time that somewhere along I just might crash.
Yeah.
No, that's interesting, right? Because while I think we all kind of are in this, not just internally being sort of better versions for ourselves, um, and the pressure that society puts, for that. I think, the one thing that I want to bring up, especially, is how do we cope with this? Like, how is that coping mechanism that's there? Because I feel like in most places, uh, we're alone, in this, or at least we feel alone in what we're doing. I don't believe, I mean, it might not be true all the time, but there are definitely times where, you would feel like you don't feel supported at home or at work or even sort of emotionally, right? Where you probably need it the most. Um, how do women sort of go about you know feeling that support coming? What are sort of practical steps that they can take? If you have any thoughts on how we could go about addressing that, that would be valuable.
Yeah, it's kind of difficult to say something to give an umbrella description of that. A lot of it goes is based on the kind of person we are. Some of us are more tolerant of things, some of us are not. Some of us are more expressive, and some of us are more inclusive. But having said that, coping basically means handling, and all of us have our own mechanisms when it comes to coping. If we talk about very simple mechanisms, old time, they would say, okay, if you're really upset, just count to 10. Then you will not say what you were going to say. Now, surprisingly, that actually works. So, one of the ways of uh, coping is to silence yourself for a little while so that all of the negativity doesn't come out. So, if we look at all the various ways of, let's say you're faced with a stressful situation, when I've asked people at large, what are the ways in which you cope? So, what I hear is, I just get out of the house, I go for a walk, I listen to music, I talked to a dear friend of mine. I open a book and read, and some of them said, I just curl up and sleep. So, coping as a mechanism is so varied. We all find our own ways to deal with it. And some of us would just lock the door and cry, right?
Yeah.
So that way of coping is tied in with the acute process of a breakdown when you had some kind of stress. The longer way of coping is to kind of rationalize and pick your battles to fight. You have a good column and a bad column. Okay, so positive, negative. So if I do this, outcome will be positive. And if I do this, it'll be negative. So I take the sum and substance of all of that and act accordingly. Right? And in
Yeah.
this process of coping with our issues day to day, we develop what we call as resilience. Resilience is nothing but bending and not breaking. So you learn how to bend, you learn how to bend enough and not break and bounce back. So that is the resilience you build over time as you walk through life and face all your problems.
Yeah, no, that's actually great. You know, it actually leads me into, this other question, that I have that comes to my mind, especially when, as a working woman, like you have multiple responsibilities, and I think Deepa brought this up earlier, you almost feel guilty, giving yourself that time to whether you feel like you need the support. So you're going to go do like a girls' night out, for example, or go have lunch with a dear friend when you have multiple other things that, you're dealing with. Um, what advice would you give to women who, end up doing it perhaps, but also end up feeling guilty at the end of it? Um, do you have any thoughts that, like you can share about, especially for those women who feel guilty? And I've been in that place many times.
So to begin with, like you were talking about the working woman, has her legs in not just two boats, in many boats, all of which are sailing at the same time. And it's a choice we have made. We have decided to work. So that's a huge responsibility we have taken. So somewhere in our mind, we should realize we are going to take on more. And if you believe in yourself and believe in what you're doing, you will not give up. Like you will try and balance. Having said that, when the demands of the family, etc., reduce a little bit, then you begin to think of yourself. And then, like you said, maybe an evening out or attending a social function, etc., without guilt. Okay, believe me, that comes only through practice. In the initial stages, it's really hard, and you go and then you want to run back because you think
Yeah.
the world at home is going to collapse. And very gradually you realize that that is okay, not going to happen. People are fine on their own. Then you're going to be clinging to your phone. When is this call coming that's going to call me back? And then later on, you have the courage to maybe put it in your bag and then much later to put it on silent. But that's a gradual, process. We have the feeling that the world rests on my shoulders. Actually, it doesn't. And sometimes we hold on and we don't give up. And
Yeah.
when it comes to saying that maybe we don't have the support systems to do that, that's also understandable. And if the demands from other people around us are too much, that's when we have to wake up to the fact that it happens only when you keep giving in. When you keep giving in, a pattern sets in, and the other person understands, like, okay, this is possible. So if I push her just a little more, I get what I want. And that is the pattern that should break. So the example I give is you're sitting in a sofa, somebody comes and sits with you. If you curl up to one side, they'll occupy the whole space. So don't allow that to happen. It doesn't mean you have to be aggressive or offensive to anybody. It just means that sometimes we don't actually share our distress or show it to them and say, look, I'm distressed. Not once, twice, but all the time. And at some point
Yeah.
in time, they'll get it and they'll say, okay, so I need to do this, so that she feels better. It'll come, but you have to be uh, persistent, consistent about it. And the message
Yeah.
usually does get across, even after, maybe in a little while.
Right. Yeah, no, that's a good point. I think, we as women, it's hard for us to say no, right? It's
Exactly.
hard to kind of, put those boundaries, for us. So I totally understand. Uh, would you, Yeah, actually, that brings me to another question. Like, why is it so hard for us to say no? Why is it that we always end up taking on, more and more and more, and therefore end up, going through, outside of all of the, like hormonal changes that our body anyway goes through, that I feel like we're adding this other layer of taking on more and not saying no, and bringing this upon ourselves. I mean, would you say that we uh, are somewhat bringing this on ourselves because it's hard for us to say no.
Yeah, this is such a culturally expected thing that if we deviate just a bit, I begin to question myself. Am I doing the right thing? And if my neighbor is doing something else, how come they are doing it and I am not doing it? So that is what we should stop. There are cultural expectations, no doubt to that, but you have to respect yourself enough to understand that you need something and you want something. And when you want it, like I said, no need to be aggressive. But if you don't say no, the message definitely doesn't get across. It's going to hurt, a time or two or three when there is a response, negative response from the other person. That is going to hurt. And you might say, okay, fine, then I'll do whatever you want. But that is where we should stop, right? So if, like I said, if you can do it consistently, the no will come.
Right. That's awesome because you're in a way saying set your boundaries and be consistent about setting the boundaries where
Exactly.
you cannot overstep.
Yeah.
And
Boundaries are not wrong. Boundaries are not wrong. We
right,
shouldn't be guilty about that. And so if you yourself are giving in and not setting your boundaries, how will others understand where your boundaries are?
right. So that's awesome. Just to go back to that stress part of it, where you're saying that, we're ignoring stress for a longer period of time. And then what would be our coping mechanism in terms of practical, everyday tips that we could use to uh, deal with it?
Yeah, see, by and large, our lives are kind of a routine, unless you have, something thrown at you in the last minute. So, one is scheduling your time
Mm-hmm.
so that as far as possible you try and stick to it, and two, being prepared ahead of time. Like if you know that you have to do one, two, three, four tasks in the morning, try and prepare something the previous evening itself, so that you're ready for the next day and you're not thrown off balance. If any task is added to you in the last minute, unless it's absolutely genuine, it's a no,
Mm.
right? So uh, these are some of the few ways in which we can cope, because we're really taking on too many things. So to be scheduled, to follow the schedule, to not get upset, and be persistent with whatever we are doing should do the trick actually.
So in a way, you're saying that be realistic about how much you can deliver and be prepared for it, right?
Yeah, yeah. You
So,
have to be very realistic. If you're not, and then you feel, initially you feel very good about taking on other people's work, and then after a little while you realize, I really can't do this. But by then the error has already happened and somebody has gotten accustomed to you doing something else, doing their work for you, right? So try not to take on things that don't yet come under your domain. Somebody else can actually handle it.
right. So in this situation, when you overwork yourself, there's a term called burnout. Can you explain what that would be?
So we are talking about stress, where there are a lot of effects on the body. When we talk about burnout, it's something that looks like the end of that road, as in you feel you don't have any resources left, like you really can't deal with anything anymore, and there is a factor where you feel you're just going to give up, like I am not even going to try. I don't want to work anymore, no interest in that. And I'd just rather, sit at home, stay with myself, no socializing, nothing of the sort. And I become totally withdrawn. So I'm burnt out. I don't have any resources left to deal even with my day to day issues. That's a burnout. Strangely, even when they are burnt out, women are able to push themselves that little bit to get through the day and get minimal work done, which is actually marvelous and surprising.
Right. So how do you deal with burnout? And
Yeah, so first thing is identifying it. Identify that you are stressed. Identify something is going wrong. Understand that this is not me. There is a huge deviation from me. I don't require others to tell me that I'm changing. I need to identify myself that this is not who I am. And that is when you need to seek help. Now, help can come from several quarters. Help can come from a family member, from a friend, etc., who are ready to support us. And if that doesn't work, and you see that you're not really able to pick up that strength, that is when it becomes advisable to go in for, therapy or counseling, to meet a psychologist or a psychiatrist. So that's what you need to identify when you need external help.
Right.
That's actually a perfect sort of segue to what I wanted to bring up. When do we actually say, okay, well, we need to recognize that we do need counseling, or we do need to go get some help externally outside of our immediate circle, whether it's talking to our immediate family, whatever. However, we're building a sort of an immediate social circle for coping, where we are actually recognizing, no, this is beyond that. This actually needs, professional therapy or counseling. How do you actually go about identifying that? And what does that look like? Because the one thing that stuck with me, Dr. Pandit, that you mentioned earlier was, where like postpartum, where the woman feels, this precious thing that they've given birth to, they're actually willing to part ways, with that. I mean, that is so extreme, isn't it? I can't even fathom that. But I'm sure women go through, that deeply. How do they recognize that, okay, well, this is what they're going through, and, now they need to go and get help, because that's the only way they're able to get out of it?
Yeah, see, in the olden times, we had joint families, extended families, and somebody would be there to support. But it's not the question now. Most of us are nuclear families. And we do worry about sharing our very personal information with anybody, because you don't know when somebody is going to turn around and mock you about anything, or, say, okay, I'm doing better than you. And that's not a good feel. So when you feel that, I'm not functioning like I should, both at home and at my job, I'm not able to give my best, and I am not happy. I'm not comfortable doing everything. There's something that's missing in my life. Okay, this is not me. That is when you need to go and see somebody. There's a lot of reluctance to this because of stigma. Because the very
Yeah.
fact that somebody may see me walking into a hospital and walking into the psychiatric setup is something that I don't want to happen. So a lot of them hesitate. I would like to say that things are changing now. People do come at an earlier stage when they recognize they have issues. They don't wait till the later phase where they are literally breaking down and are non-functional. They do walk in, earlier, and they don't mind sharing that they are seeing a psychiatrist. I'm not saying that's happening in a big way, but it's definitely happening in a small way. So the point of breakdown is taken as I need to see a psychiatrist, which is not really a good thing. They should be walking in when they are, quite badly distressed enough to recognize they are not functional.
Yes.
No, that's actually so important, right? To be able to recognize that and say, okay, well, this is the next step forward.
Yeah.
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 So, how does counseling look like? I mean, many of them are intimidated with, or don't understand what a counselor can do or what a psychiatrist can do. They're fearful of the fact that, okay, I'm going to be put on medication instantly, or, you know,
Yeah.
I think that's the broad myth that people carry, that there's going to be immediately, there's going to be some medication, I'll be addicted to it, and there'll be that many side effects, and they don't turn up. So what would you say to that?
Speaking for myself and most psychiatrists I know, we defer medication unless and until it's actually required. So we try to handle issues through therapy. Therapy is nothing but when a trained individual is helping you address your issues in a manner that becomes easy for you, to help you to learn coping strategies and mechanisms, to deal with the issue and to develop resilience in the long run. So that is what therapy is about. Now, there are times when I would say just therapy is not adequate. When the syndrome of depression is severe, when anxiety is so severe that it's incapacitating, when a person has panic disorder, they absolutely need to go on to medication. I have faced problems because, see, we have to be absolutely clear to them about the medication and give them the choice of taking or not taking medication. Autonomy is the first rule of treatment. So if I feel a person needs medication but they say no, I wouldn't put them on it. I give them the choice. And
Right.
if they say they will take it, all the pros and cons are discussed, the side effects are told to them, and whether the medication is addicting or not is also explained, and how long they should take it, etc. All of that is explained, and only then we start with the medication. A reluctant patient is never given,
Definitely.
medication. Yeah.
Right.
The problem we also face, for example, in therapy, is that we plan out a therapy spreading for like 4 to 6 sessions, but unfortunately, many of them for various reasons, stigma or otherwise, and the family may not be cooperative. They don't come back, and when we give them medication also, which they require for a few months, they may take it for a week or two and say, "I feel better," so that the family is comforted by it and not come back. They're ready to, suffer whatever they're going through, but they will not take medication because the family says, uh, you know, don't take it. Don't listen to her. You're going to get addicted. And this happened to X, Y, and Z, and I've read about this, and stuff like that. So we kind of get upset that the patient loses the benefits of treatment.
Yes. Dr. Pandit, how does a normal, like say a smaller issue, not like too large, how long does it take to sort of address an issue? Like, would it be 1 session, 2 sessions? How many months does it go on? Just to give an idea of someone who's never been to a counselor.
Okay. See,
Like,
usually if it's something like a here and now, a person has basically been able to cope with all issues, but there's something that's happened here and now. So 1 or 2 sessions to tide over that acute phase would be enough. Okay.
okay.
If it is that they are facing issues for a longer period of time and a lot of change is required in that person, then
Hmm.
that would take, we would be looking at about 6 to 8 sessions, lasting maybe 2 to 3 months or so. Uh, that's about it. Longer therapy, like what would happen before, is not really practiced anymore because that appears a little impractical in terms of patients coming to us very, repeatedly and for a longer duration of time. That seems a little impractical. So
Hmm.
even the schools of therapy have changed now. And adapted so that 6 to 8 weeks of therapy definitely benefit patients.
Okay. If there was one thing you wish every woman could hear and believe about her mental health, what would it be?
Okay, I would say the few words would be that you have to understand that you are important. First thing, you are important, you are very important, and your mental health is very important too. And you are in charge of yourself. So you have to remember that you're probably the most important member in your family because uh, what you're holding together and what you are giving to each member of the family is something that nobody else can do. So, in order to preserve that, you have to keep yourself intact and give yourself all the care that is required.
Yeah. So ideally, I hope other members of the family are hearing this too. Thank you, Dr. Pandit. I think we're open to questions from the audience. If anyone has, they can ask in the chat, and we can answer that.
Yeah,
Meanwhile,
there are a few here.
yeah.
So let me feel those. There's one which talks about, do you feel, when we change, the culture will also change over a period of time? and a few years down the line, a new normal is set?
Most definitely, because I think if we look at our grandmothers and the kind of lives they led, and then our mothers and what they did, and us and our children, so it is changing. Culture is definitely changing. The older generation, some of them find it hard to let go. They are not so adaptable, and they will try to ensure that the older norms are persisting and carried on. Works to some extent, but change is what is definite. For the better, for the worse is something that we have to wait and see. We don't really know. But change is definitely happening and will always happen.
Right. So there's this another person who's asked, great insights, doctor. As a young woman, I saw a mother go through heavy unpaid labor all her life for an unappreciative and exploitive family, and eventually harmed her physical and mental health. As much as I love my mother, I would never want to end up like her. On top of this, witnessing in real time how the society has created a system of suppressing women, mostly mostly passively and sometimes aggressively. This has made me petrified to be a part of this and or get affected by the system that has put me under extreme pressure of overperforming in my career, thinking having some power would safeguard me to some extent, but this comes at a cost. What I fear that is I'm not performing up to standard. I get scared for my life, thinking someone is on their way coming for me to trap me in that bottle. How do I cope with this?
So, this is not uncommon, this is quite common. What we experience in our childhood, the scars usually stay and stay forever. What happened to her mother is what happened to many women in that generation,
Right.
where because you are not financially independent, you do not stand up for yourself, and you do not have the courage to say that I'm going to be on my own. When it comes to issues like, say, physical abuse, that's not something any woman should tolerate. A woman should be out of that marriage, you know, as quickly as possible in order to preserve herself. But because an individual is not capable of taking care of herself and her children, she stays in the abusive marriage. Now, what the lady has undergone, what she has witnessed, is going to be with her for the rest of her life. And I would say that her overcompensation is basically due to that. Like she says, I do not want to be, a part of such a relationship ever. I need to be independent. Yet at the same time, you also need to understand that in correcting something, you should not harm yourself. Trying to overperform is going to harm you in some way. Initially, becoming an independent person and earning for yourself is going to push you that way, but you have to realize that that is going to harm you in a different sort of way. So you need to slow down. If you've made the link yourself, that's simply wonderful that you're doing it because of that. Now that you have understood it and you've realized it, now is the time to slow down. And if you really can't deal with whatever scars are there, it doesn't hurt to see a therapist, right? Or if you think that I would rather manage it myself, seek all the emotional support that you can get from those around you, at work, friends, family, etc. And always remember that that is not going to repeat in your life unless you let it repeat, which is what we've been talking about. Sometimes we let things happen, we don't draw boundaries, and we let things repeat. So, not letting it repeat, I think, is totally in your hands. Be careful not to get involved in abusive relationships, and stay away from anybody when you get the first inkling that this person is going to be abusive or push me around, and say no to that to keep yourself safe.
Right. Yeah. Dr. Pandit, sometimes you notice that in friends or in family that require counseling, how do you gently nudge them to see a counselor? Because sometimes it's not taken too well, right?
Yeah. So two sides to that. One, they may not want to come, and two, if they do come, there is a great deal of internal resistance
Yeah,
in them that prevents them from changing. So that is also detrimental. Ideally, those who seek help have to seek help willingly. Having
correct.
said that, if anyone says that, look, I think my sister needs help, but she's not ready to come, so I say to them, talk to your sister and say, just come once.
Mm,
Come once. You come with me. I will take you. I will do the talking. You meet the doctor once. You take it from there. If you're not comfortable, we let it go. If you're
right.
comfortable, then you can take it from there. Usually, that one point of contact.
Oh, it's possible that her,
Battery ran out.
yeah, we'll wait for her
Yeah.
to log in. Meanwhile,
Yeah. I mean, thank you all for the questions. I think it's great. Hopefully we'll be able to. She'll be back. On. If not, we'll be sure to sort of circulate. Um,
yeah, we'll
the
attend Famida Begum's questions. We'll
yeah
probably, if you could just uh, put in your email ID, maybe we can answer that for you.
yeah. Awesome. Well, I know we have 5 minutes. So we'll see if we can get her back on. If not, I think I'll we'll wait for her. But if not, I just wanted to actually thank you all, for coming. I mean, this was hopefully helpful, to you guys. It's definitely been, it's helpful to me just talking about, being deliberate and intentional about, prioritizing things, not taking too much on, and then being overwhelmed, and then saying, oh my God, no one's supporting me, or, like letting that guilt come over and overwhelm us. I do, want to say a few things that you guys, hopefully will carry from this conversation is that you are not weak. I think, Dr. Pandit had, this thing to say that, you are very important, not just important, like very important. Please remember that. You are not weak. You have the power, and you're also human. So it's okay sometimes to be vulnerable. And when recognize that when you do need help, to go and get that support. Healing for each one of us is not a solo journey. Like, you do deserve that support. So please get the help. And I know Dr. Pandit is not on, but we definitely thank her for all of her, wisdom, her insights. And, it was great that, she was able to join us today and kind of, and for, again, the other thing is, each one of you for showing up for yourselves today and, being able to, spend the hour with us. I think it was, we're very thankful. I do want to say that hopefully this conversation resonated with each one of you, and you'll stay connected with SIRA and join our
Indeed.
community. And oh, it looks like she's going to be back on.
Yeah,
So
sorry about that.
No, that's okay. This is great. Perfect. You're back on. I know there were a couple of other questions.
Just two
I let,
questions which you want
yeah.
to go ahead, Rashmi, just ask them.
Okay. Yeah. So, what the one question that we have here is, once a person is on medication, Dr. Pandit, because they needed it at a certain time, but after a while, how should, the person sort of wean off the medication?
Okay. So, most of the medication that we start, let's say for an intense anxiety or for a severe depression, We give it for a period of time, say 9 months to a year, and we wean it off. The reason for that is, let's say they take it off somewhere, after a few weeks or months, there is a tendency for them to develop the symptoms again. So, right at the onset, we give them a time and say, you need to be this on this medication for this period of time, and we will take it off depending on how well you are. And they need to follow those instructions. Taking off the medication is definitely on our minds, as we see them. So, either increasing the dose, decreasing the dose, or stopping is definitely something that will be followed up very closely.
Yeah, no, absolutely. And, just another question here is, how should, someone who's depressed or anxious, person cope or handle when your loved ones, know you're on medication, but still make you feel, down or torture you or,
Yeah, it is going to be very difficult because the concept of depression, for example, what is it that you don't have? If you remember, Deepika Padkone came forward with her depressive symptoms and talked about it, and in fact, she had her photograph all over the place for the Indian Psychiatric Society as well. And the question that strangely everybody was asking was, how come she's depressed when she has everything? So they fail to understand that this is biological, that there are some neurotransmitter changes in the brain that cause depression or cause anxiety, and medication is what is going to make it go away. Believe me, if it is a woman, it is definitely hard to keep the woman on medication when the family doesn't understand the concept of mental, disorders or mental well-being or mental health. It's very hard, and when she's not able to, come by herself for treatment, it's even harder. So the way I go about it is to involve whoever has come with her, let's say the spouse or the son or the daughter, involve them in a major way and explain to them the consequences of not treating the condition and what are the things that can go wrong. So, by and large, if the caregiver you tap, we are able to keep someone in treatment. All of the family may not be in sync with that person, but you have this one person to fight with the patient about requiring medication. So that is how I go about it.
Yeah.
no, that's great.
Yeah.
Awesome. Well, I know we're at time. Really want to thank you, Dr. Pandit, for sharing all of your insights. You've, been tremendously generous. And again, to our audience, thank you for showing up for yourselves and, being here. Hopefully this was as valuable to you all as it has been for both. I'm going to speak for Deepa as well as for myself. It's been great. If again, this conversation sort of resonated with you, I would urge all of you to stay connected with SIRA, join our community. We do have future events and sessions coming up. We host these once a month. Our next one is on entrepreneurship, which is coming up in September. So let's definitely be, learning together and growing together. Until next time, take care of your minds, your heart. You deserve all of it. Like I said, and I'm going to repeat what Dr. Pandit said about, you are not just important, but very important. Thank you again.
Thank you, Dr. Pandit.
Thank you, Rashmi. Thank you,
Keep
Deepa.
the sentence bend, don't break with me. Thank you so much.
Thank you so much, both of you.
Thank you.